You've got a voice, but are you ready for a global audience? Don't just settle for standard studio rental. At Live the Dream Media, we amplify your voice by broadcasting your podcast completely live on our exclusive online radio network. Whether they're down the street or across the world, your listeners can lock in live on YouTube, Meta, and the Live the Dream Media app. Why choose live? Because real-time connection builds a loyal community, extends your reach further than ever, and turns a simple recording into a massive digital event. Stop waiting on the edit. Go live, build your crowd, and live the dream with Live the Dream Media today.
Radio evolves more as the years progress, and it is only becoming better. Introducing the Live the Dream Media app. Catch your favorite music 24/7 and tune into live podcasts, or catch up on your own time with our on-demand library. No matter where you travel in the world, you can be anywhere on the planet and stay connected. Download the Live the Dream Media app for free today on the Apple App Store and Google Play, and experience radio reimagined.
Ready to go live? Take your show to the next level and host your podcast at the Live the Dream Media Professional Studio. From our fully equipped space, you can seamlessly connect with your audience and live stream in real time straight to YouTube, Twitch, Facebook, and more. We handle the technical side so you can focus entirely on your content. When you book with us, you get access to top-tier microphones, premium production gear, and full support from our professional audio engineers, all with flexible booking times designed to fit your schedule. Go live with our studio team today. Visit ltdmedia.net or call 520-373-2059 to book your session and live your dream live on air.
It's termite season.
Hi, it's me.
And bugs fear the blue trucks from Essential Pest Control.
Go blue at Essential Pest Control. We'll eliminate those bugs, bees, and termites. And stop paying too much to that national provider. Buy local for great service and affordable rates. Call Essential Pest Control because termites fear the blue.
Run for your life.
Call for the blue trucks from Essential Pest Control. 886-3029. That's 886-3029. Or check online at essentialpest.com.
This is Ed Wilkinson with Wilkinson Wealth Management, where we manage money for gun owners. What does it mean to retire comfortably and remain comfortably retired? It means designing a plan that allows you to do the things you want to do, outpace inflation, and never run out of money in your lifetime. If you want to retire comfortably and remain comfortably retired, call me, Ed Wilkinson, at 777-1911. That's 777-1911 or WilkinsonWealthMGMT.com.
I'm proud to welcome my good friends at Tucson Iron and Metal Retail to Inside Track as an advertiser. Jamie Kipper and her staff are conservation experts. They sell round and square steel tubing, metal plate and roofing materials, as well as new and used steel, aluminum, and stainless steel to ranchers, artists, interior designers, roofers, as well as you do-it-yourselfers out there. Tucson Iron and Metal Retail is open Monday through Fridays, 8 a.m. to 4:30 p.m., and Saturdays, 8 a.m. to noon. Tucson Iron and Steel Retail, 701 East 36th Street. Call 520-209-1576. That's 520-209-1576, or go to TucsonIronRetail.com. Come by and be sure to ask for Jamie. Tucson Iron and Steel Retail. This is what conservation and repurposing is all about. The views and opinions expressed on Inside Track are those of the hosts and their guests, which do not necessarily reflect those of LTD Media or their sponsors. But they should.
Welcome to Inside Track with Bruce Ash and Ed Wilkinson on the Live the Dream Media Network.
Hello, everyone, and a pleasant morning to you wherever you may be. Welcome to a special edition of Inside Track. Ed Wilkinson here, coming to you live from the Live the Dream Media Studios in Marana, Arizona. Bruce is on assignment behind enemy lines in Coronado. Thanks for joining us on Live the Dream Media app or watching us on X, Facebook, YouTube, or any of the other platforms out there. The first half of this show is brought to you by our good friend Eric Rudin from Essential Pest Control. Call Essential Pest for all your needs to get rid of insects, vermin, and weeds today. Call them at 886-3029. Summer has arrived and there are lots of bugs and pests and vermin invading homes and offices. Bugs fear him. Call Essential Pest today to keep your home and business free of those bugs. Also supporting Inside Track is my great company, Wilkinson Wealth Management, where we manage money for gun owners and guide you to retire comfortably and remain comfortably retired. Call me at 777-1911. Also, Bruce's company, his family-run company, is a new sponsor, Paul Ash Commercial Real Estate, where they make good things happen every day, and they're all over Tucson. Last but not least, Tucson Iron and Metal Surplus. Call them for all your metal needs. Go down there and take a look. They are great. We're going to switch things up. We're going to talk about a topic that affects every family. And as we age, we spend more time with physicians, yet many people don't know how to get the most out of them. We have with us Dr. Michael Lavor. Michael's a graduate of the University of New Mexico School of Medicine, 1985.
Roughly.
Right. Okay, roughly. He's been here in practice. He had Saguaro Surgical. He did a wound care practice for a number of years, still does all that. And so we're going to talk about all these things that happen when your body gets old and what you need to be doing. Mike, you've had about 41 years of experience helping patients. Let's begin with a simple question. If you could change one thing about the way patients prepare for an office visit, what would it be?
I would say most patients come in not prepared. They come in and they say that I have a pain or I have a cough, which, by the way, my chronic cough may bug you, but sorry. They may have something that they can describe in one word, but that's by no means adequate for the physician taking care of them. So one of the things I would say that every patient should bring with them is notes, and I will go over some of that about what those notes should be, and another person. It's been estimated that up to 80% of what a physician tells you in the office is gone by the time you hit the parking lot.
Really?
Yeah. So you might say 60%, but between 60 and 80%, they don't remember what you said. And I have that experience with my own family where I've been with them and they go in to see the physician and we come out and I say, so are you going to do this? Well, he didn't say that. And I said, well, yeah, I did. So one, the patient should be intently listening to the physician about what's going on, not necessarily taking notes, and the person who is there with them can listen to the physician in relationship to their friend or relative or whatever and take notes. So it's very helpful from that standpoint.
So I show up, let's say it's a brand new, well, not a brand new physician, but let's say I show up to a physician, it's my very first visit. Let's say my old guy died, retired, whatever the case may be. I get an appointment with my new doc.
I show up. What should I expect? What do I need to be bringing with me, and what should I expect from him?
I don't care whether it's your old physician you've been seeing or a brand new physician you're seeing or a provider, which may be a nurse practitioner, PA, or a physician.
Does that matter?
In some cases, I may say it matters, but whoever you're seeing is who you're seeing right now.
Okay.
Does it matter what you bring? No. So obviously, your current medications, including vitamins and supplements, should be brought with you and written down. Any allergies that you have, and I don't just mean hay fever, but any allergies to medications, and the reason that you've been told you have an allergy to this. Previous surgeries. If you come in and say, I have leg pain, and then and that's all you've told them, but you leave out the fact that you had endovascular procedures for blocked arteries, then that's obviously important.
Okay, why is that important?
Well, no matter what surgery you've had, there are potential complications from the surgery, either short-term or long-term, or recurrence, such as in vascular disease, you may have a blockage that's been cleared, but it's recurred. And you don't know how long that's going to take to recur. You can have a re-blocked artery as short as 2 hours after the procedure.
Really?
Depending upon if you're clotting or not, et cetera. Or you may have a piece of plaque dislodges a year later. Or you're being treated very, very well, taking care of yourself, and you do quite well for 5 years. So knowing what surgeries you've had will potentially correlate with whatever your complaint is.
So I show up. I take vitamin C. I'm a big believer in that. I'm also doing what is that? Super Beats. Does it really matter whether I tell him this or not?
Absolutely.
Why?
Vitamin C can have complications in itself. You may also say that I'm just spouting a number out. You're taking 20,000 units of vitamin C, and one thing you may do is say, okay, well, your kidneys are putting out 15,000 units, and so you're wasting that. Vitamin C happens to be a coenzyme in wound healing also.
So what do you mean by that?
It's an enzyme that helps helps wounds heal. There are many different things that help wounds heal, and that happens to be one of them. As far as Super Beats, I'm not familiar with that as much. They say it helps with hypertension, but I don't know how. But any supplement can have a potential interaction with another medication, or you have, say, 5 supplements you're taking, and 4 of them have significant doses of magnesium, and you're taking a magnesium supplement. So by bringing all those things with you and having them written down, the physician can look this up and know exactly what's going on. So I think it's very important. If you want to know what potential complications there can be with a supplement or whatever, I think the pharmacist is a great resource. If you have a pharmacist, take in your supplements, say, I'm taking this medication, he should already know what you're taking. And, should I not take this with it, whatever. So, yeah.
What about family history?
Family history is exceedingly important, and I'll just use an example of breast cancer. So, and by the way, if you came in with a lump in your breast, which males do have, to a percentage of about 1% of males, that could be you. So, but let's use a female. So a female feels a lump in her breast, and she goes to see her physician and says, I felt this lump. Well, number one, how long have you had it? I don't know. When did you last feel it? Yesterday, probably a little too quick to get into the doctor, but maybe 2 weeks ago I felt it. Taking a shower and I felt it. Okay, we're going to go ahead and, the other thing he's going to want to know is it painful? What can you do? And this is really with any complaint. What can you do to make the pain go away? What can you do to make the pain worse? So she says, well, it's not really painful, which is not necessarily a good sign at all. And it moves, which is important. And then he may say, well, what is your family history based on breast cancer? Because this is obviously one of the things you're worried about. And you say, well, my great-grandmother on my father's side had breast cancer. Well, that doesn't make any difference because it's the father's side. My mother's mother had breast cancer. That's important. So the maternal and female side of your family is important for something like breast cancer. So the family history of that plus how old was your grandmother when she had it? How old is the patient? If a patient has a lump that turns out to be breast cancer and they're 30 years old, that's a problem. If they're developed breast cancer and they're 70 years old and their grandmother developed it or their mother developed it at 70 years old, by the way, sisters count also, any close relative on the female side. All that's very important as far as his decision about what can be done. And after it's diagnosed as a cancer, say it does come back as a needle biopsy being breast cancer, then the family history is important also, along with all the chemical testing, et cetera, they do as to what the treatment is, as far as chemotherapy, radiation therapy, et cetera.
So what about skin cancer? We live in Arizona. There's lots of sun. A lot of people don't do anything to protect themselves. I go to the doctor, say, hey, I've got this spot on my arm.
Same thing, is that what you want to do is start out with the basics. I've got this spot on my arm. How long have you had it? 2 months that I know of. Are you sure you didn't have any longer? Now, this is another important thing about having, say, your wife or spouse or whoever with you, because they may say, no, I noticed that about a year ago. Okay, has it changed? Is there anything you've done to it? If you've done something to it, has that made it worse or better? So in Arizona, melanoma is higher on the list than in some states because of the sun exposure, as you mentioned. But you could also have a basal cell or a squamous cell. A basal cell may be there for a long time, and you can do a simple excision and everything's fine. A squamous cell may have been there for a long time also, but they'll tend to grow a little bit quicker. So getting that excised or treated with what's called Mohs procedure or whatever is also very important.
Is that something your family practice doc or your internist does, or no?
Usually not. There are some internists, call them old-time internists, that may do simple excisional biopsies. And I call it a biopsy, but really it's an excision of the lesion, because you don't really want to do a biopsy where you take out part of it and send it off, because if it comes back positive, you just have to do another excision. So a excision of the lesion where it's sent to pathology and you check for the borders, make sure they're negative, check for the depth and make sure it's negative. Some family practice people will do that, but frequently they'll send them to a plastic surgeon or a general surgeon or someone like that.
Okay, so I show up at the doctor, whether it's my very first visit or not, I want to tell them all the meds I'm currently taking.
Absolutely.
Is it not enough to say, well, it's in the computer, look it up?
No. Frequently, I'll speak for myself, I don't necessarily go over the computer that closely. I may scan it and take a look at it. I'll have it for a record, but I really would like to know what the patient tells me. So the patient comes in, they fill out a form, and they have all these questions about what their symptoms are, et cetera, et cetera. I may glance at it, but I want to know what the patient tells me. So if the patient hands me a piece of paper, one, I know he thinks it's pretty important. And so I may look at that right in front of him and address those concerns with him. And I'm also one to call it an old-time position where I don't really like to deal with the computer a lot while I'm dealing with the patient. So if I'm looking at the computer asking him a question, to me it's not that personal. If I'm looking at a piece of paper that he hands me, I think there's a bit more interaction.
So you should come in with a list of stuff.
Yes.
Okay.
So,
now,
yeah, go ahead.
What if you show up and you're just there to say, hey, I need to start a new doctor relationship. I really don't have anything wrong with me that I know about. What should I, as the patient, expect from the doctor's side?
That's a really good question.
Because if I don't know what to expect, how do I know if they're doing what they're supposed to do?
Well, one, you don't even not know what to expect, but you don't know how this person is. Much as I hate to say it, not everybody likes me. And someone comes in and they say, well, I need to have something done, and it's the first visit, you're actually checking out the physician and the physician's checking out you. And to have that kind of a personal relationship with your physician, I think is very important. So your initial visit, whether it be a primary care physician or a specialist or whatever, what I would expect from the visit is, how does he interact with me? Is he listening to my questions? Is he responding to my questions? Is he explaining it in terms that you would give to a fifth-year surgical resident, or in terms that you would give to somebody who is a secretary in an office and has no medical knowledge. So being able to communicate with the patient, I think you should expect you should expect that to be able to happen. Looking at the physician, does he look like a professional person to you? And I would.
What do you mean by that?
Does he come in and he's got body odor? I'm being pretty extreme, or something like that. And the same sense from
smelling
a patient
of cigarettes
standpoint,
and booze.
Exactly. Well, cigarettes and booze gives me a key right off the bat that we need to have a discussion.
Yeah.
But in the same sense, from your standpoint, you as a patient should come in with a courtesy to be physically representing to the physician where you're not a slovenly person, call it that. So the physical appearance, both sides, the communication capabilities, both sides, and whoever you brought with you, I think it's extremely important for the physician to recognize that person. Say, hi, I'm Dr. Lavor, and you are who? I'm his sister. Okay, fine.
So you as a physician don't mind, and you've brought it up a couple of times, you don't mind, and you almost expect that they should have somebody else with them.
I don't necessarily expect it, but I much prefer it.
Okay.
Because you can get more information where the patient is, again, scared. Call it white coat syndrome. Your blood pressure is elevated, you're anxious, and the other person is not as much. So they may be able to add things. So yes, I much prefer someone come with them.
Okay, so for me, I show up. I absolutely have white coat syndrome. Can take my blood pressure at the dentist office. It's like 115 over whatever. Walk into the doctor's office, it's 135 or 140 over whatever. How important is that, and does that really matter?
Not really. I just had a patient the other day that their normal blood pressure, which I know it is because I have a record of them, runs about 118 systolic, and they came in, we took it, and it was 157. And I just explained to them, and they understand also that, yeah, my blood pressure goes up. Now, if I take that and their blood pressure is 220, then I think that's important. And I'm not an internal practice or internal medicine physician, so I would refer them back to their internal medicine. And I think the collegial communication between physicians, which is another thing that I think patients should expect, I would probably call that physician and say, hey, by the way, I saw Mary Jane, and her pressure, which normally is relatively normal, was 220. And I think that's very important to communicate that.
Okay, so I show up, get the relationship going, everything's great. The doctor finds nothing wrong. Should I expect him to run labs or wait until something's wrong to do that?
No, I would expect, this is your first visit with this physician, if he has no records in the chart, or he has no chart. So if he has no records of any chart that you didn't bring with you, another thing which I say when you come in, particularly to see a physician for the first time, bring in your latest lab work. Bring in your latest EKG, your latest MRI, your latest chest x-ray, so that he has all that data, and then based on that, he can then decide what he may want to have done.
Okay, so you talk about bringing in your latest records. Where are we getting those records from? Do we get that from the old doctor? What do you do?
If your old physician retires or leaves town or whatever, the medical records are required to be kept on file somewhere for X period of time. Varies depending upon state. And therefore, you can call the office and say, I need a copy of my records. And if you say, I need a copy of all my records, you're going to have a problem because you're going to get a ton of information. You want to know not necessarily his notes, maybe his latest note, but you want to have any lab work that's been done and any x-rays that have been done, any EKGs that have been done, any specialist evaluations that have been done. And if you bring those with you, that would then allow the person you're seeing to say, okay, look, we don't have this, we don't have that, so I need to have a basic metabolic profile done, a complete blood count done, et cetera. Give you an example is my wife actually went in to see somebody and had some lab work done because she hadn't had it for a while. And he looked at the lab work and put on her chart that she had early stage renal failure. And she brought me the lab work, and I looked at it and said, you don't have any renal failure, you're dehydrated. You just worked out and you got your lab work done. I literally said, go drink a couple glasses of water or a quart of water, and get your lab work done again, and it came back normal.
See, and that's what happened with me. Speaking of lab work, how often? So many of our listeners are, they're not spring chickens; they're a little bit older. How often should they get lab work done?
Depending upon any symptoms that you have that are ongoing, I would get lab work at least maybe within a year. But if you have a elevated prostate level, I'd probably get one every 4 to 6 months at a minimum. If you have something wrong with one of the lab works, I'd get a follow-up within 3 to 4 months, again, depending upon what it is. Obviously, if you had an infection and your white cell count is 20,000 and normal is 12,000, you want to get that checked relatively soon. So the variability of time as to when you have something done depends on if you have something going on. But just routine work somewhere within a year probably is acceptable.
Okay, so annual physical, get the lab work done, all that. You talked about prostate. What's for the men out there, or the women that have prostates? How many? Hey.
Okay, we won't get into that topic, but I personally know of no females that have a prostate.
What's the prostate level that you're happy with? What's the prostate level that you're concerned with? The PSA.
It's very variable as far as what the PSA, prostate-specific antigen, is, and it depends upon your age and a variety of other factors. So if you're 20 years old, your prostate, your PSA may be 1.2, high normal 2.5. If you're 40, 50 years old, it may be 2.5, 2.5 is the low, 3.5 is the high. If you're 70, 75 years old, your high normal, I think the accepted level is like 5.7 or 5.8. But what's more important to that is if your PSA on say you're 45 years old and you get your first PSA and it's 2.3, it may be a little bit high. And then they check it again 6 months later and it's 4 or 5, the percentage of increase is significant. Also, it's estimated and been written that approximately 80% of 80-year-old men will develop some type of prostate cancer. So if you have a PSA and you're 85 years old and the PSA is 10, is that important? Again, depending upon the symptoms, you can get a PET scan, see if you have metastatic disease all over, talk with your urologist or whoever you see for prostate, and determine what you might want to have done, to the point of recommending doing nothing. Again, if you develop prostate cancer at age 45, you have a problem. If you develop it at age 85, maybe not so much. It's estimated you'll die from something else besides prostate cancer at age 85, so don't treat it.
So many people have multiple specialists. They start off with a family practice doctor. They graduate to an internist. I don't know what the difference is between those two, but at some point then they have other specialists that they see. Why is the internist not seeing all of it, or that's beyond their scope?
People are becoming more specialized. So call your family practice doctor the physician who's taking care of your family, your children, your teenagers, yourself possibly. Internists would tend to be more specialists to older people. And by older, I mean 30, 40, 50. Then you have geriatric specialists that may be taking care of people 65 and older, because obviously there are different things in those categories and you need to be more informed. The general family practice doctor that delivered babies, set bones, et cetera, 40, 50 years ago in the Midwest, they don't much exist anymore for a number of reasons. But I am a trauma, vascular, and general surgeon, so I did all three, which is also not normal or not usual. So when you have an internist or a geriatric physician, he may want to have, say he does an EKG and it looks abnormal. He's going to have a specialist look at you. If you have a X-ray of your chest and there's a nodule that wasn't there 2 years ago, he may have a pulmonologist. So you want to have a specialist who's going to give the final recommendation for what something is.
So people get older, and I'm going to deal with the guys right now. Sorry, ladies. At what point does a guy need to go see a cardiologist or any other specialist, or even dermatologist?
Let's use the cardiologist. If someone is fit, has no chest pain, has no shortness of breath, has no swelling in their legs, has none of those symptoms, and has a normal EKG, the need, and I don't know if I mentioned it, but say he's 45 years old, the need to see a specialist is probably not necessary. As soon as you start developing something, and I'll use something really simple, swelling in your legs, it could be caused by a lot of different things. Say that you're not obese, because just obesity itself will cause that, or can cause that. But say you're not obese and you have some swelling. Is it because of pulmonary problems? Is it because of congestive heart failure? Is it because of venous disease? Is it because of some arterial disease? What? So possibly seeing a cardiologist because some symptom comes up is what I would do, but I would go through your internist and say, hey, this swelling in my leg is new. I don't know where it is. And he could do an EKG, et cetera. Now, there's some misconceptions, I'll bring this up now, about EKGs. The EKG tells you what's going on right now and some of what has happened in the past. It does not tell you what's going to happen 1 hour from now. And I literally had a patient who had left the office of a friend of mine, cardiologist, with a normal EKG. Well, not normal. He had some old changes that were there, but no acute changes, no symptoms of anything going on, and had a massive heart attack and died in the parking lot.
Wow. What could have? How would he have known? How would he have had any idea that was going to happen?
That's the problem, is they may not have. So in that light, you asked about when should someone go see one. I recently needed to have some surgery, and I have not had a cardiology workup ever. And at age 77, which I am right now, I thought, you never know what's going on, so I better get a workup. So I called a cardiologist and said, hey, I think I need to have a complete checkup. And also, it's safer. You don't want to go under anesthesia, but with a potential problem. And so I had that done. So if you're going to have some kind of a major procedure done, you want to make sure that your heart is in good shape, particularly if you're older. If you're 30 years old, sometimes it'll require an EKG. That's it.
Okay. We've got like 1 minute before the break. Do you encourage patients to use the patient portals?
Yes, I do, because that's also another place where you can get information that has been put in there by the physician. And you can get your lab work out of there. You should be able to get x-ray reports, et cetera. I personally, when I look up a patient's data, I may read the report, but I also read the x-ray. Patients can't do that. And I strongly recommend that people print out that information for, one, if you go see a specialist, two, if you travel. If you travel, just take some of that information with you, stick it in the envelope, stick it in your luggage. So if you end up with a problem somewhere else, they have a comparison.
All right, we're going to come back in, I guess it's 3 minutes, and let's bring up travel at that point. We got to pay the man. Don't switch stations. We'll be right back.
You're listening to Inside Track with Bruce Ash on the Live the Dream Media Network. Now a word from our sponsor.
It's termite season.
Hi, it's me.
And bugs fear the blue trucks from Essential Pest Control.
Go blue at Essential Pest Control. We'll eliminate those bugs, bees, and termites. And stop paying too much to that national provider. Buy local for great service and affordable rates. Call Essential Pest Control, because termites fear the blue.
Run for your life.
Call for the blue trucks from Essential Pest Control. 886-3029. That's 886-3029. Or check online at essentialpest.com.
This is Ed Wilkinson with Wilkinson Wealth Management, where we manage money for gun owners. What does it mean to retire comfortably and remain comfortably retired? It means designing a plan that allows you to do the things you want to do, outpace inflation, and never run out of money in your lifetime. If you want to retire comfortably and remain comfortably retired, call me, Ed Wilkinson, at 777-1911. That's 777-1911, or WilkinsonWealthMGMT.com.
I'm proud to welcome my good friends at Tucson Iron and Metal Retail to Inside Track as an advertiser. Jamie Kipper and her staff are conservation experts. They sell round and square steel tubing, metal plate and roofing materials, as well as new and used steel, aluminum, and stainless steel to ranchers, artists, interior designers, roofers, as well as you do-it-yourselfers out there. Tucson Iron and Metal Retail is open Monday through Fridays, 8 a.m. to 4:30 p.m., and Saturdays, 8 a.m. to noon. Tucson Iron and Steel Retail, 701 East 36th Street. Call 520-209-1576. That's 520-209-1576, or go to TucsonIronRetail.com. Come by and be sure to ask for Jamie. Tucson Iron and Steel Retail. This is what conservation and repurposing is all about.
Welcome back to Inside Track with Bruce Ash on the Live the Dream Media Network. Now back to our show.
Welcome back to Inside Track. Ebb's here, Mike's here. We're talking about stuff that you need to talk to the doctor about, and the doctor needs to talk to you about as you get older. We were getting into travel. Mike, I travel a lot. I'm leaving again tomorrow. What should I take with me when I go on these 2 and 3 day trips or these 2 and 3 week trips?
Yeah, I don't care if it's a 2-day trip or a 1-day trip or a 3-month trip. You never know when something's going to happen. Get in a car accident, you fall, you do something, whatever. So having a file that you just carry around with you, it'll take you a short period of time to put everything in it. Put your latest MRI, your latest chest X-ray, your latest EKG, your specialist reports, your latest lab work.
Pop it on a thumb drive?
You can put it on a thumb drive, or you can print it out. Again, I'm old-fashioned, so I'd print it out and then just hand the folder to the person I'm seeing. Because if you go in and say, I have this funny little thing where all of a sudden my hand didn't work, and you're 55 years old, and you don't smoke, the doctor's going to go through all kinds of neurological problems, et cetera, et cetera, et cetera. But if you say, I had this funny thing happen where my hand didn't work for a short period of time and then it got all better, I had little blurred vision in one of my eyes, and then it got better, that could be a transient ischemic attack. Well, if you have a workup in your chart that you brought with you, or your files that said you had a carotid ultrasound, and it's normal, and it was 1 year ago, then they're going to eliminate that immediately and do an echo of your heart and say, uh-oh, does this guy have atrial fibrillation, or does he have something? So something like that can, one, decrease your costs that you're going to be spending for medical care, expedite the care to be done more efficiently. So having all that kind of information when you travel, again, whether it's 1 day or 3 months, just stick it in your luggage.
Okay, so along with travel, I don't know about you, every time I turn on the TV, I'm seeing advertisements for these medical kits, the prescription drugs that they can give you, that you can carry with you, and you should have all the time in case something goes wrong because it takes too long to see the doctor, whatever. What are your thoughts on that?
I have mixed feelings on it, but I think there's a positive part of it. And I believe, I'm not sure of this, but I believe when they first came out with those advertisements, there was something missing which I was not happy about. And then they added it, I think, later on. It may just be that I don't remember it. But when you go to use whatever one of these medications that you have in this kit that you purchased, and you have a sore throat, you can use this medication after a consultation via a doctor. So apparently, and I've never used this, et cetera, nor have I called them, but apparently they have physicians or providers on call that you can call and say, okay, I have this sore throat, and I have a high fever, and I had strep a year ago, and they say, okay, take the penicillin. And then is it important to follow up? I think it is important to follow up, either where you then go to urgent care or something later on, but you can start treatment right away. So there's plus minuses on it, but as long as you communicate with someone and not just taking a antibiotic or medication with no real knowledge about what you're doing, I think that's good.
Okay, so that brings up another point. how do you know when it's important to call the doctor or the nurse or go to, the urgent care center? Because people wake up with sore throats all the time. At what point should somebody say, yeah, I should probably go see somebody about this?
Yeah,
and whatever it is.
That's a very good question, and that's why I think it's also important to have in your house something like a blood pressure cuff or something to be able to take a blood pressure, a pulse oximeter. Both of them are relatively cheap, easy to use, a thermometer.
Okay, let's go back to the so I have one that you put on your wrist, punch a button, and it does whatever. Is that adequate?
Yes.
Okay.
Because is it going to be the absolute perfect blood pressure check? No. But it's going to make a huge difference if that reads 120 over 70 versus 215 over 110.
Okay.
So it gives you an idea, yes.
And what about the pulse ox? Tell me about that.
The pulse ox is the same thing. So your pulse ox should be running somewhere around 94, 96. I think below 89, Medicare says you may have a problem, get it checked out. But if you know that your pulse ox normally runs 94, and all of a sudden you take it and it's 85, and you feel a little funny, and your fingertips are a little bit blue, and your chest a little bit sore, you know immediately to go to the physician or go to an urgent care. So having those at home to do a quick check on something, I think will help you. But anytime you have something that is acute, that, in other words, it happens all of a sudden, and is persistent, doesn't really go away. Like sometimes you can twist your knee and then 2 hours later it feels fine. I wouldn't worry about it. But you have pain in your abdomen and it localizes to the right side, and within 12 hours you're really not feeling good, I'd go to the emergency room.
So funny you should mention that. I had that a couple of years ago. Called a friend of mine who is also a surgeon. He said, do you still have your appendix? I said, yes. He says, okay, it's probably that. Go to Tucson ER and hospital, have them check it out. I went there. Kidney stones.
Right. So it doesn't necessarily, because that physician or surgeon didn't examine you, because if he'd examined you and you said you had pain in the right side of your abdomen and did a percussion on your back and found out you had pain with percussion in the back, you'd be, you may have something wrong with the kidney, like a kidney stone.
Right.
So, but what he did tell you, okay, based on your symptoms, go to the emergency room.
Right.
So something that is acute and getting worse relatively quickly, absolutely go to the emergency room or urgent care or whatever. If you go to urgent care and they think it's more serious, they'll send you to the emergency room. If it's something that's chronic, that's been going on and seems to be getting worse, I would get it checked out.
What aside from blood pressure cuff and pulse ox, what else should you have at home if you're serious about taking care of your health?
I would have like an emergency medical kit, such as something to take care of wounds, some ACE wraps, some gauze.
Thermometer.
Pardon?
Thermometer.
Thermometer, yeah, I mentioned that. And that's all I could think of off the top. But some kind of a kit where you can take care of a wound urgently. If you have a splint or a sling that, say you injure your arm and you sometimes can damage something by moving around, you have a sling, maybe having a sling at home would be helpful.
Okay.
Basically, I can think of.
Right. One of the things that you brought up, happened to me. I ended up going to the gastroenterologist to get a colonoscopy. I'm talking to the anesthesiologist. He says, what drugs do you take? And I told him, I have high blood pressure pill. I took that. Taking a statin, take that. And then he's digging in and wanting to know about, other drugs like cocaine, marijuana, etc. Talk about why he needs to know that. Why does he care? I mean, now I told him, look, I'm a drug virgin. But why does he need to know that?
Many of the drugs, marijuana, cocaine, fentanyl, et cetera, he's going to be giving you some of those medications, not cocaine, but he's going to give you medications that may accentuate what you've taken. So not only is it important to say, honestly, yes, I've taken cocaine. I last took it 4 days ago, which may not be quite as important acutely right now. But if you say, yes, I used marijuana and I had some 2 days ago, yes, there still could be an interaction. Marijuana can stay in your system much longer than some of the other medications. And the strength of marijuana, it's estimated today, compared to, say, 10 years ago, maybe 10 to 12 times higher than what it used to be.
Okay, so let's talk about that. Arizona is one of those states that have decriminalized marijuana, and you can go down to many of the street corners and buy it from a licensed distributor. People are saying marijuana is safe. It's no more dangerous than drinking beer. Your thoughts?
That's not true. Just to be blunt, it's not true. And it so happens on Fox News this morning, there was an interview with a physician who was discussing the significant increase in marijuana use versus alcohol use. And I think she mentioned something like there are 3 million more people taking marijuana now than actually use alcohol. Again, both of them on a more routine basis. So people, you say, well, marijuana is really not dangerous. The psychosis, the mental effects, the inhibition to reaction times, et cetera, are absolutely true. And there was a study years ago in the military of Denmark where they studied their military and found there were significant problems, and they banned it. And then England also basically banned it. Marijuana is a drug. Should it be researched and should it be used for certain things? Possibly. The discussion this morning even said that people say, well, I use it to help me sleep. Unfortunately, there's no good pro-randomized studies that they were saying that confirm this or that helps with my depression. Again, there are poor studies out there. So I am not a fan of legalizing marijuana, and I think that people look at it as something that is not really a problem. It's a drug.
Okay. What about obesity? How much of a problem is that? And at what point are you really obese? And I bring that up because back in my Marine Corps days, if we were being checked by the BMI scales, and almost every one of us was failing, even though we were like 5% body fat.
Yeah, that's really intriguing because I've served in the military. Actually, I have 3 military discharges. Latest served over in Afghanistan as a commanding officer of a forward surgical base, and we had our men and women that we also got tested before they went, tested when they came back, and it turns out you can't do some testing while you're in a war zone, which is kind of ironic. But we had one individual whose BMI was way above what the normal standard is, and his waist measurement was way higher than what it should be. But he could bench 500 pounds, and his body fat was like 5%. Well, that's not a problem. But when you look at the overall appearance of the body and take some measurements and do BMIs, yes, there are standards. And it was estimated before at least his last year and a half, 2 years, that 70% of high school students don't qualify for the military either on physical standards or mental standards. And I don't know what the breakout was between the two of them. So obesity is extremely important. It's one of the causes for diabetes, hypertension, heart disease, vascular disease, venous disease, abdominal problems.
What is venous disease?
Venous disease is when you have veins that normally return the blood to the heart that have valves that are present. If you have obesity, you can increase the pressure in the veins and disrupt those valves. Therefore, you can get swelling of the legs and what's called venous stasis ulcers on the lower extremities and the ankle area, which are very difficult to heal. So it's kind of ironic. I heard another thing the other day where people were talking about it. Used to be kind of said, well, it's okay to love your body, which I agree with. It's okay to be obese. Well, if that's true, then why is everybody, not everybody, but many, many people using the anti-obesity drugs, I'll just leave it at that, the shots or the pills or whatever, and losing significant amount of weight. And now they're actually doing some studies and polls that obesity is maybe not considered to be acceptable. Now, to be a little bit overweight, not a problem, but to be 400 pounds, that's a problem because you are you will have significant medical problems. You'll shorten your lifespan, and you have an effect on everybody around you. So, should you be happy with the way you are? Yeah. Would you be happier with if you were a little bit skinnier? Not skinny, but a little bit less obese? I think so.
So expand on that. I want to go back to family history, but expand on that. I listened to Fox News, people like that, and Kennedy has basically tipped the food pyramid upside down, concentrating on more proteins, getting rid of the simple carbohydrates, getting rid of all the additives and things like that. Your thoughts?
Basically, my thought in a very simplistic way is overindulgence in anything is bad. Moderation in everything is probably not bad. If you look at a picture of a group of people in 1930, men and women, and you look at a picture of a group of people in 2025, there are a significant number of increased obese people. What did they eat different? There were not as many processed foods. They ate maybe bought from the farmer's market or whatever. They had more fresh food. They had more food cooked at home. So what you eat, whether it's getting rid of sugars or carbohydrates or whatever, increasing protein helps with a lot of different things. But again, if you have kidney disease, you may not want a whole lot of protein. So again, talking with your internal medicine doctor is saying, okay, I want to be healthy, and this is what should I eat? Well, based on your lab work, you should maybe do this, that, that. So what he's doing, I think, is very good. I think it's bringing to light people being aware of what their weight is and what's good and bad for your weight and how to control it. Exercise, activity, and I don't mean diet, but just eating normal or not eating between meals, you'll lose weight.
Okay. Let's go back to family history. How important is that for your physician to know?
Again, it's very important, as we talked about, one, family history of whatever disease, whether it be cardiac disease or breast cancer or prostate disease or whatever, some things that have a genetic component to it.
Dementia?
Dementia. At what age did your mother, father, sisters, aunts, uncles develop this? And did they die from it? Because you may develop some symptoms of heart disease at age 50, have no treatments, and die at age 95 from hit by a car. But the progression of disease, the age that someone in your family has something is very important.
What if you're adopted?
Yeah, that's a problem, because you, if the adoption is completely hidden and you have no idea who your who the parents of the child were, then you don't have that benefit. And in that light, let's say dementia. You may say, well, okay, I'm adopted and I'm now 55 years old. My mother had, or the mother that adopted me had Alzheimer's at age 60. I'm kind of worried about that. You can get DNA testing for some things. Some people don't want to know. They just want to have, just live the way they are, live a good life, exercise, etc. So if you're adopted, there's a problem, because you don't have that luxury of having some kind of a family history.
Okay. Colonoscopies, mammograms, things like that. How often should you really get those, and at what age should you start?
I think mammograms have been, I'm just going to pick a number, kind of average. People have said maybe age 40, 45, getting a mammogram. Obviously, you have any symptoms such as pain, tenderness, swelling in your breast, getting a mammogram is important. And then based upon what that mammogram shows, do you get it annually or every other year? And then do you need to have one after age 75? The answer is I would. If you plan on living to 90 and you all of a sudden develop a small mass, it's pretty easy to take care of. So some people, insurance companies, will recommend you don't necessarily have to have something after age whatever. In the same realm of colonoscopies, if you have a family history of problems with the colon, you have a uncle who developed colon cancer at age 25, you need to start maybe getting a colonoscopy. Your first one maybe at age 30, 35. Totally normal, maybe the next one 40, 45. Any polyps or something like that, maybe a year or 2 years later. So once you know the family history, if there's something positive, that may make you do something earlier. And then based upon the results of what you have done, you can change the frequency based on that.
How much of today's medicine is preventative rather than treatment-oriented?
I think, unfortunately, and there are studies of this, but I don't remember exactly what it is, but you can Google anything.
If it's on the internet, it's got to be true.
Yeah, right, exactly. Careful with that. I think most of it is a treatment, and most of it should be preventative. Treatment, obviously, more so when you're young, and preventative as you get older. But you do need a combination of both.
So you're talking about getting older. One of the challenges of getting older is figuring out what's normal and what's a warning sign. So let's go through some of the changes people commonly experience, like chest discomfort, shortness of breath. At what point do you know that it's normal? What point do you know that it's a problem? Like I work out a lot. And when I talked to my doctor, he said, do you get shortness of breath when you work out? I said, yeah. He goes, that might be a problem. What do you do? And I told him, he goes, oh, well, no, that's perfectly normal.
Exactly. And you just answered the question. Because if you're not active and you have chest discomfort or shortness of breath and you're not doing anything, it needs to be checked out. Multiple reasons can be the cause of it. If you are working out and get short of breath, which is the same thing I do, then I wouldn't worry about it. But if you are working out and you're getting increasing short of breath, so again, changing in the symptoms that you have, then may dictate you have it checked out. So if you get short of breath after doing 90 push-ups, and then it's 80, then 70, then 40, you need to get checked out, just as an example.
What about the brain and memory loss and things like that? You know, everybody talks about, oh, I've got sometimers disease, or, you know, where they forget things. At what point do people start to really need to be concerned about that?
Well, as we get older, our memory is not going to be as sharp, obviously. That is, again, one of the huge reasons why it's very important, particularly with something like this, to go to the physician with somebody. Because you may say, the doctor says, so do you have any problems with memory? No, I'm fine. And the person with you goes, you couldn't remember what you had for dinner last night, and you couldn't remember what we did last week, but you could remember what happened to you when you were 5 years old. Very important information. So same thing as if you think your memory is going, or you're seeing things that are not seen, well, if you are seeing things that are supposedly there, but they're not, again, communicating with somebody that you're with is really important. Like, hey, did we do this last night? And they go, no. Then communicating with somebody, working with somebody, and increasing frequency of losing thoughts or memories or whatever, then I would get checked out.
Yeah, it reminds me of a joke. Wife takes her husband to the doctor because he's starting to get forgetful. You know, at least she thinks so. And the doctor says, well, you just have to start writing these things down. It's really important. They get home, and the guy says to his wife, I think I'm going to go, you know, make myself some ice cream. She says, okay, get some for me too. Write it down. He goes, I'm not writing down that I'm getting ice cream. In fact, I'm going to put, you know, hot fudge on my ice cream. She says, great, write it down. And put nuts on mine and write it down. He says, I'm not writing it down. She goes, write it down, and put a cherry on mine as well. Write it down. He goes, all right. So he goes into the kitchen. 20 minutes later, he comes out, gives her scrambled eggs and wheat toast. She says, where's the jam?
Yeah, both of them need to get checked out.
Exactly. Bone and muscle health. As we get older, you know, our risk of falling and breaking things increases, and especially, you know, people breaking their hips. Talk about the importance of that and what they can do to at least curtail, if not prevent, that stuff.
Well, it's really the same thing as far as increasing number of falls, increasing intensity of pain, increasing frequency of pain with particular movements need to get checked out. But as they say, lotion is motion. So as we get older, our joints are not the same as they were when we were 20, 30 years old. activity, exercise is very important. And I got to throw in this, and I know our time's getting a little short, but smoking is horrendous. And to be honest with everybody, I smoked for probably 20 years, started in the military during the Vietnam era when basically we got cigarettes for free. I was a cross-country track runner, didn't see there's any problem. Physicians used to advertise smoking's good for you. Smoking is terrible in many, many, many ways. So anything you can do, particularly as you get older, don't smoke. And that goes along with marijuana. But yeah, the bone problems are going to increase, back problems are going to increase, increasing intensity of back pain. Get seen, get an MRI, and you'll find out whether you have osteoporosis or arthritis or stenosis of the spinal cord, some things that can be fixed, some that can't. But if they can't be fixed, then you can be told what to do to alleviate potential problems.
Should you wait for your doctor to recommend it, or should you be saying, hey, doc, at this age, I think I need an MRI for this?
No, you don't need to say I need an MRI for this unless you have something that's going on wrong. And I'll give you an example of just myself, that I was having increasing lower back pain. It got more and more intense. Then I started developing a little neuropathy going down the leg. I said, I need an MRI. And over that time period was about 2 years. So then I told the doc I need an MRI, got it, had severe stenosis, had surgery, everything's fixed. But if I had waited longer, I may have had more permanent damage. So same thing, change in frequency, and increased intensity of a particular problem, get it checked out. And don't wait 1 or 2 or 3 years. Some things will change very, very gradually to the point where you almost don't notice it, but still important. Some things may change quickly. Absolutely get those checked.
Okay, let's finish with some practical advice. If you had 5 minutes with every American over the age of 50, what would you tell them?
Don't smoke, lose weight, exercise.
Okay, nice and succinct. Okay, lightning round. One word, or at least short answers. Biggest health myth?
Marijuana is okay and obesity is okay.
Biggest mistake patients make?
Waiting too long to have something checked out.
Best investment in your future health?
As we talked about, activity, no smoking. Social activity also is very important.
Oh, okay.
For mental.
One number everyone should know?
911. And you should really kind of have an idea what your normal blood pressure is.
Okay. One habit you'd eliminate if you could?
Smoking and overeating. I quit smoking, and I never I shouldn't say I never overate. I'm a sugar fanatic. But with my activity and exercise, I can tolerate more of that. So, yeah, smoking was probably the best thing I did.
Okay. One habit you'd encourage everyone to start tomorrow?
Exercise. And I don't care if it's walking a block, then at the end of 2 weeks or 3 weeks, go to a block and a half. Then at the more, go 2 blocks, 3 blocks. And if you're walking down the middle of the road, get a mental health check.
Mike, thanks for spending the hour with us. Love to have you back and talk about other things coming up. The questions that we ask our physicians are important. The advice you gave is absolutely important. I'm Eb Wilkinson. Bruce Ash is going to be back next week. Thanks for listening to Inside Track on Live the Dream Media. Until next time, take care of yourselves and each other. We look forward to seeing you again in 167 hours.
You're listening to Inside Track with Bruce Ash on the Live the Dream Media Network. Now a word from our sponsor.
It's termite season.
Hi, it's me.
And bugs fear the blue trucks from Essential Pest Control.
Go blue at Essential Pest Control. We'll eliminate those bugs, bees, and termites. And stop paying too much to that national provider. Buy local for great service and affordable rates. Call Essential Pest Control because termites fear the blue.
Run for your life.
Call for the blue trucks from Essential Pest Control. 886-3029. That's 886-3029. Or check online at essentialpest.com.
This is Eb Wilkinson with Wilkinson Wealth Management, where we manage money for gun owners. What does it mean to retire comfortably and remain comfortably retired? It means designing a plan that allows you to do the things you want to do, outpace inflation, and never run out of money in your lifetime. If you want to retire comfortably and remain comfortably retired, call me, Eb Wilkinson, at 777-1911. That's 777-1911 or WilkinsonWealthMGMT.com.
I'm proud to welcome my good friends at Tucson Iron and Metal Retail to Inside Track as an advertiser. Jamie Kipper and her staff are conservation experts. They sell round and square steel tubing, metal plate and roofing materials, as well as new and used steel, aluminum, and stainless steel to ranchers, artists, interior designers, roofers, as well as you do-it-yourselfers out there. Tucson Iron and Metal Retail is open Monday through Fridays, 8 a.m. to 4:30 p.m., and Saturdays, 8 a.m. to noon. Tucson Iron and Steel Retail, 701 East 36th Street. Call 520-209-1576. That's 520-209-1576, or go to TucsonIronRetail.com. Come by and be sure to ask for Jamie. Tucson Iron and Steel Retail. This is what conservation